Next, I'd like to introduce a very talented physician. She has a wonderful name. She's no relative of mine, Dr. Diane Alexander. Dr. Alexander is a pediatric cardiologist, and she's affiliated with the Dr. Eric Williams Medical Science Complex at MT.HOPE Hospital in Trinidad. Dr. Alexander.
Ladies and gentlemen, good evening. I want to bring greetings from Trinidad and Tobago, and on behalf of the children of Trinidad and Tobago, to explain to you, the audience who've come here this evening, exactly why this benefit concert is being held. First of all, I want to thank the President of the Friends of Trinidad and Tobago and the members of her organization for putting on this benefit and for inviting me to come here this evening, and also to thank all of the performing artists who so far have been doing a very, very good job, as well as the Mighty Sparrow for giving of his time this evening. Now, I have no talent, I can't entertain you, so I'm going to stay on stage for as short a time as possible, but I really wanted to let you, the audience, know what is happening in Trinidad and Tobago, particularly with the children who have heart defects. Now, my job in Trinidad is to diagnose and manage children with heart disease, and I've been doing that for the last 9 years. Now, as most of you know, we have a population of 1.2 million. And every year, we assess about 200 new potential cases. And roughly, we see 1 or 2 children per week who require open heart surgery procedures. Now, we cannot provide open heart surgery. We can do some limited surgery, but all the children requiring open heart surgery have to be sent overseas, particularly to North America. The majority of them come to New York, some go to Canada, and they come for open heart surgery procedures. Now, in the last 9 years, we've been able to improve on our techniques for making early diagnosis. So we can now diagnose a child with a problem within the first few hours of life. And in the next few months, we'll be able to do as they do here in North America, to diagnose these problems in the womb. It means, therefore, that without having the facilities for open heart surgery, we sit and we tell the parents what is wrong with the child, and then we tell them, unfortunately, that child, if you do not have the funds, will have to go on our waiting list. As it stands, when we did our census earlier this year, our waiting list of children for surgery number well over 100. Some of those children, unfortunately, will not have surgery because by the time they wait, they will become inoperable. We have some children who've been waiting 9 years now for open heart surgery. That is about the time I went back to Trinidad to start working there. As well, some of you may not be from Trinidad and Tobago, but may be from places like Grenada or Guyana. And we also assess the children from Grenada and more so from Guyana who are in need of open heart surgery. And I can tell you it's even more difficult to get surgery for children who live in Guyana simply because I cannot help them through our embassy in Trinidad, and getting a visa for a child in Guyana is exceedingly difficult. Now, in addition to the growing list, we have problems with getting children to North America. Because of the change in the healthcare system, because of hospital managed care that now exists here in North America, more hospitals are profit-driven and have been forced to minimize the degree of charitable work that they do for us. As well, we've had problems getting some families the visa. If you're suspected of probably not returning to your country, you will be denied the visa whether or not the child needs surgery. And also funding has been a problem. Now, against this background, a group of physicians and nurses from Miami developed a group called Caribbean Heart Menders Association. That group began working in Jamaica about a year or so ago. It was with the help of that group, we hope to begin open heart surgery in September of this year. To do so, we will require approximately $600,000 US to begin the program. This will help us to get the equipment that we need. We do have some of the equipment because for the last 5 years, we have had a successful adult open heart program. The funds will also help us get what we call disposable items, items that you can only use per patient and items that you will have to dispense of after use in one patient. We will also have to provide accommodation for the group of 15 nurses and doctors who are coming to work along with us at the Eric Williams complex. These nurses and doctors are giving of their service freely. None of the local team will be paid anything above their normal salary for doing this work. It will mean in September, if we can start with the 10 cases that we hope to start with, we will have started a program that will decrease our waiting list, that will make an open heart program open to the children, not only of Trinidad and Tobago, but of the southerly Eastern Caribbean and Guyana in South America. We hope then that your generosity here tonight will be appreciated and that you will go out as members of the audience and tell the West Indian community what they can do to help us help ourselves. Ladies and gentlemen, I thank you for coming. I also want to thank the Friends of Trinidad and Tobago for putting on this benefit. Over the last 5 years, they've helped us tremendously by accommodating children, by sending funds whenever they can, whenever we've needed it. And I also want to thank the performers. Thank you very much.
Thank you, Dr. Alexander. We wish you a lot of success in your work and trust that we will find our ways here to support you.